Thanks for joining. My name is Reese, and I am a public health nurse at HKPR, and I'm here with my colleague Holly from Peterborough Public Health, and we're going to begin with a land acknowledgement. So the Kawartha Pine Ridge District Health Unit and Peterborough Public Health are situated on the traditional territories of the Michi-Sagi, Mississauga, Anishinaabe, and Chippewa nations. This includes the territories of Treaty 20 and Williams Treaties. We respectfully acknowledge that these are the nations are the stewards and caretakers of these lands and waters for all time, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We recognize the many harms done to Indigenous peoples and our collective responsibility to right those wrongs. As organizations that are rooted in a colonial system, we are committed to change, to building meaningful relationships with Indigenous communities, and in improving our understanding of local Indigenous peoples as we celebrate their cultures and traditions, serve their communities, and responsibly honor all of our relations.
So for today's presentation, we will begin with opening remarks from Dr. Bocking and Dr. Piggott, and then we will transition into a presentation about the Nurse-Family Partnership, including an overview of the program, a case study, and some information on the referral process. We will then have time for questions before closing remarks. I would now like to pass it over to Dr. Piggott and Dr. Bocking for some opening remarks.
Great, thanks very much, Holly. So my name's Natalie Bocking. I'm the Medical Officer of Health and CEO of Haliburton Kawartha Pine Ridge District Health Unit. And I know that Dr. Piggott is on as well. Do you want to do a quick intro and then I'll go into my intro remarks?
Sure. Yeah, good afternoon, everyone. I'm Thomas Piggott, and I'm Medical Officer of Health, CEO of Peterborough Public Health.
So we're really pleased to be able to join today to welcome you to the session and thank you for joining. We're really excited about this new program. This is a great collaboration across our two health units for really an evidence-based public health intervention that we know has really important outcomes. So the Nurse-Family Partnership, for those that this is a new program for, has actually been around for multiple decades, was developed in the 1990s, is implemented across 8 different countries, 40 different states in the US, and has been implemented, becoming more widely in both British Columbia and in Ontario now as well. There's a few other health units in Ontario that have been doing this program, and HKPR and PPH are really excited to now join that group of health units that are able to offer this program. It's a specialized program that requires some specialized training for the nurses that are involved, that targets really young individuals and their first-time pregnancy. One of the things I think that's most exciting about this program is that it's challenging to get evidence per se in public health because we have complex contexts often. But this really truly is a program that has had multiple evaluations, including some RCTs or randomized control trials in the States that have demonstrated improved health outcomes among both the mothers as well as infants. So this includes things like decreased substance use, decreased incidence of speech and language delays among young children, improved mental health outcomes. So I think a lot of opportunities here, and really pleased that we were able to bring this program to the region, I think in particular at this point in time. So I'm going to pass over to Dr. Piggott now to provide a couple of additional remarks. And again, thanks from my end for joining the session.
Yes, thank you. And thanks, Natalie. So thanks everyone that's joining or listening to the recording afterwards. I think when we look at the data around public health, population health, the need for this program and the impact that this program will have on our community is clear. So, as you'll learn with the criteria as this progresses, the NFP program targets first-time mothers under 25 that are experiencing socioeconomic disadvantage or limited support. When we look at the proportion of births that happen in populations under 25, It's probably about 11% for their first baby in this region, both regions, Peterborough and HKPR. And when we look at the proportion of people that have a low income or other potential challenges to their support for that healthy child development, barriers to having the resources needed to help to support healthy child development, it's higher here in this region, most of our region, than it is in the provincial average when you look at low income level. When you look at some other health related indicators, we have very high rates of reported mental health challenges among people who are pregnant, and challenges with other health related considerations, including smoking, substance use, we know, and other nutritional challenges or deficiencies. We think that there will be a combined reach in these regions of well over 250 babies and families per year, just under 130 in the HKPR region, and just under 140 in the Peterborough public health region. And so these families, we will be seeking your support for help as healthcare providers to have as many of them referred as possible for help. You'll hear more about how to do that. You'll hear more about the evidence behind the program. You'll hear more about the criteria and what the program looks like. But I did just want to start with some remarks to the need, because we know the need is here. We know increasingly communities are challenged as income inequality, housing unaffordability, all of these massive issues that we know and often talk about as the social determinants of health are increasingly challenged in this region and in our province and country. But the NFP program is really a critical opportunity to provide supports for healthy growth and development that starts, and we think, focuses on these babies, these families, these new families, but has a lifelong impact for the rest of that person's life. The evidence shows that their health will be impacted if we can support them more early. And so with that, I'll turn it back to the team for the rest of the presentation and just thank everyone for joining.
Wonderful. Thank you so much, Dr. Piggott and Dr. Bocking, for that introduction. As you both mentioned, Nurse Family Partnership is an evidence-based home visiting program, and it's targeted to first-time young mothers who are in need of additional support. In this program, public health nurses visit mothers and families frequently during the prenatal period and up until the child turns 2 years old. Together, the nurse and the mother cover a diverse range of topics, including healthy eating in pregnancy, newborn care, understanding infant cues, goal setting, safe sleep practices, and family planning, among many others. Our program is centered around the client, and we prioritize providing support tailored to the mother's individual needs and preferences. The success of this program and the positive benefits for families rely on a therapeutic relationship between the public health nurse and the client. For this reason, the public health nurse and client visit as often as once a week, with adaptations to the home visiting schedule depending on the client's needs and life circumstances. As mentioned, Nurse Family Partnership has been expanding all across Canada, and we are now 2 of 9 health units in Ontario offering this program. Oh, sorry, Race, you're on mute.
I apologize. So with the goals of the Nurse Family Partnership Program, there are 3 overarching goals. So the first is to improve pregnancy outcomes. So we help women with their health-related behaviors, as Holly mentioned, including reducing substance use, encouraging physical activity, proper nutrition, as well as improving child health and development by helping parents provide responsible and competent care for their children, as well as developing positive parenting techniques. And finally, we improve families' economic self-sufficiency by helping parents develop a vision for their future, planning their pregnancies, as Holly mentioned, and assisting them in continuing to enroll in their education, training, or find work, whatever their preference is.
The Nurse Family Partnership Program has specific eligibility criteria, as the program was created and evaluated for a very specific population. To be eligible to enroll in the Nurse Family Partnership, the individual should be expecting their first child, or they will be parenting for the first time. This criteria allows for those who may have had a miscarriage, adoption, a termination, or apprehension. They can still remain eligible for the Nurse Family Partnership Program. NFP is designed to take advantage of the ecological transition, this window of opportunity in a first-time mother's life. At this time of developmental change, a woman is feeling vulnerable and more open to support. Another piece of eligibility criteria is that the individual must be age 24 or younger and experiencing social or economic disadvantage. Some examples of reasons you may choose to refer your client to NFP would be if they're experiencing food insecurity, if they have little social support, mental health concerns, a developmental delay, or based on your own judgment. The individual also must be enrolled early in their pregnancy, specifically by their 28th week of pregnancy. Early enrollment allows time for the client and the public health nurse to establish a relationship before the birth of the child, and it also allows time to address prenatal health behaviors which affect birth outcomes and the child's neurodevelopment. So with that being said, the earlier enrollment in this program, the better. And finally, the individual must be living in the area served by either of our 2 health units. So to summarize all of that eligibility criteria, if you have a client who is age 24 or younger, who is less than 28 weeks pregnant and will be parenting for the first time, and they're facing some sort of concern or risk and they need some additional support, we're happy to support them through the Nurse Family Partnership.
So specifically, why does the Nurse Family Partnership focus on pregnancy and early childhood? So as you can see from this graph on the slide, prenatally and during the first 2 years of a child's life, the period in which the NFP program works with our clients, basic functions related to vision, hearing, and language develop. And it's during this time that the registered nurses can have a significant impact on the health of both our mother and child. And so listed on this slide are several of our program components. So as Holly mentioned before, NFP is client-centered, so we recognize that the client is an expert on their own life and individual goals are set to follow their heart's desire. And then us as nurses may help them recognize their strengths and identify solutions to their issues while recognizing that only a small change is necessary. In terms of motivational interviewing, we are constantly listening for change talk with clients to strengthen personal motivation for and commitment to a specific goal. We recognize the person's own reasons for their change and within an atmosphere of acceptance and compassion. We have a trauma and violence informed care approach. So we approach all clients as if they have a history of trauma, spending time developing a trusted therapeutic relationship with them and recognizing the effects of trauma on their health behaviors. And this program is also grounded in the theories of self-efficacy, attachment theory, and human ecology theory.
The Nurse Family Partnership Program is divided into content areas that cover 6 domains. Within each domain, there are a variety of topics that the public health nurse and the client will address together. So the first one is personal health, and personal health is about taking care of your physical and your emotional needs. This domain addresses the client's health practices, nutrition, exercise, substance use, mental health, and more. Maternal role, the second domain, supports clients in transitioning into their new role as a parent and navigating the many challenges that come along with that transition. Environmental health involves addressing the safety of maternal and child health in the home, at work, at school, and in the neighborhood. For example, the public health nurse could support a client in reducing or eliminating secondhand smoke or putting in safety measures at home for a toddler. And these are the final 3 program domains. Family and friends is about social support and building healthy relationships. Life course development focuses on the client's goals related to planning future pregnancies, completing their education if they choose to do so, and accessing employment. And health and human services includes timely referrals and facilitating access to other community resources and supports. On this note, we wanted to mention that we recognize that strong connections between community partners and the Nurse Family Partnership are essential to ensure collaborative wraparound care for young women and their families. Our goal is to complement services that are already being provided to our clients, not to duplicate.
So for a case study, we just wanted to go over a situation where the nurse-family partnership was implemented versus not, and kind of the differences in outcomes. So our first scenario, we have Sam. So Sam had a referral done by her primary care provider because of her risks on her HbHC screen. One of the nurses contacted Sam and offered our home visiting program. So Sam had a lack of education around how to have a healthy pregnancy, whether or not to take her prenatal vitamins and the importance of prenatal care, and getting education, as well as needing mental health support. So within the program, Sam learned about the changes to have a healthy pregnancy, the importance of taking those vitamins, having prenatal appointments, specific education on signs of labor, what the delivery process looks like, and as well as what healthy attachment with her child, and as well as getting a mental health referral and being connected to community resources. So Sam carried her baby to term and had a healthy pregnancy without any complications, was able to make informed decisions during labor, and felt confident while in the birthing process. Had learned new coping strategies through the program, became a responsive parent, and had Sam's child had good physical and mental health following. In comparison, Amy did not have the HbHC screen done, and so her risk factors were not identified, and she wasn't referred to the Nurse Family Partnership Program. So Amy had a more difficult time coping with day-to-day life and developing the relationship that was needed for her development, with her child's development. So Amy also had mental health concerns, but because she wasn't referred to this program and that her risks weren't necessarily identified or related to mental health, she didn't necessarily get that referral for her mental health support, as well as the education she needed around taking prenatal vitamins, and the importance of prenatal education wasn't necessarily there, and didn't understand the stages of labor or available medical interventions for herself, and didn't necessarily pick up on her baby's cues and responding to her baby's needs. So Amy had more of a negative birthing experience because she didn't necessarily have this information. Her baby had poor attachment and struggled with emotional regulation and behavior. And Amy's child grew up with the physical and mental health issues because of this.
Yeah, so through that case study, we can see that the Nurse Family Partnership Program can really provide that support that first-time young mothers might need as they're going through this process for the first time. We did want to tell you guys a little bit about how to refer to our program. So to refer clients to Nurse Family Partnership at Peterborough Public Health, the process is fairly straightforward. Just go to Peterborough Public Health's website and search for NFP or Nurse Family Partnership. When you get to the Nurse Family Partnership page, you can click on the healthcare provider referral form link at the top, and it will just bring you down to a direct link to the referral form. And this is what the referral form looks like. There are just a few things we wanted to draw your attention to. This form is also shared with our Healthy Babies, Healthy Children program. So when you're filling out the referral form, please remember to complete this section with the arrow here that says first child / first time parenting. This will help us know which program we can enroll the client in. The reason for referral, where the second arrow is another section that can help us know what program the client is eligible for, and also just have a little bit more information about their risk factors. And then finally at the bottom, the fax number, you can send the referral form to this fax number, or if you'd prefer to call in, you can always give us a call. Now, some of you might be familiar with the Healthy Babies, Healthy Children screen. We also use this screen in the Nurse Family Partnership Program to determine the client's risk. If you could include this screen with the referral, that would be greatly appreciated. At the bottom here, section E says healthcare professional observations. This is just a section in which you can check off if you have any other concerns about your client's well-being and just give us some general information about their risk.
So From HKPR's perspective, our referral form is also very similar to Peterborough Public Health and has similar areas to draw attention to as well, and is shared with our Healthy Babies, Healthy Children program. So from our perspective, a referral, if you're involved as an Ontario Health Team partner that uses CareDove, you can find our referral form in the system and have it sent electronically to us. And it can also be found on our website under Healthcare Provider Resources, and there's a section called Family Healthcare Providers. And this form, as I mentioned, can also be used to refer to our HBHC program. And as well, if you're unsure which health unit your client would be serviced by, please send your referral to either health unit and we'll make sure it gets to the right place. And you can also as well call us and we could take a referral over the phone. So thank you for coming today to learn about our program, and referring your clients is a great way to help them who are pregnant and may need some extra support. If you have any questions about the program or how to refer, don't hesitate to reach out to us, and spreading the word about our new program can help us reach more clients. So our contact information to get more resources or have more information will be on the next slide. So this is our contact information. If you want to request a presentation or some NFP resources, such as a poster or brochure, please reach out to your local health unit at this contact information, and we can get that to you. And I will turn it over to Dr. Piggott and Dr. Bocking for some closing remarks.
That's great. Thank you very much, Reese and Holly, for a great presentation. I don't think I have a lot to add at this point, other than to say we're excited about this program, and I know that primary care providers and nursing programs currently supporting these women are incredibly busy. So we appreciate your ability to send in referrals and complete the forms as best as you can, and looking forward to working in partnership with everyone. I'll pass over to Dr. Piggott.
I'll echo the same and just to thank you for the presentation today, for those of you joining and for those of you listening to the recording. We continue to want to make this as streamlined and as easy as possible for primary care and other prenatal care providers, because we know how difficult the health system and life is these days. But we really hope that this additional new program, this new service for folks, and again, the highest needs perhaps population that we serve, more isolated, vulnerable first-time parents, we think that this will really help folks in the community, and we hope you do too, and we hope you tell folks about it as well, and help to spread the word. And we are very excited. We've both health units have received our first few referrals, and things are going well for those clients so far. So we really appreciate the support as we embark on this, and we won't keep you any longer than we need to, because we know how busy you are. But please don't hesitate to reach out if we can help or support or answer any more questions.
Wonderful. Thank you both. And again, thank you to everyone who has joined us today or everyone who is listening. For those of you who are on the call, if anyone has any questions, we'll open up for some questions and we'll answer to the best of our ability. And if not, again, feel free to reach out to either of our health units and we'd be happy to address those questions. I'll just give it a minute, and then if not, we can go back to our busy days.
Holly, thank you so much, and Reese, for this presentation. I know we have recorded it as well, so we'll be sending this presentation out to our primary care providers and those who couldn't quite make it for today. So thank you so much.
Okay, thank you, everyone.